Hello, nurses all over the world. My name is Nurse Felicia. I want to welcome you all back to my YouTube channel, and I want to appreciate all of you for coming back to my YouTube channel. This means a lot to me. I hope you've been gaining one or two things from my channel, and I hope to see you subscribe, comment, and hit the like button. Thank you. So today we'll be talking about the differences between rheumatoid arthritis and gout. For the past 2 weeks now, we've been talking about gout and rheumatoid arthritis. So I just want to talk about the difference between the two. So the first one is talking about the cause. The cause of gout is just the accumulation of uric acid crystals in the joints. So it's the accumulation of uric acid in the joints. And talking about rheumatoid arthritis is just the autoimmune disorder whereby the immune system attacks the joint lining. Where are the places that are commonly affected in gout? The place commonly affected when it comes to gout is big toe. Don't forget I mentioned podagra. Another name for big toe is podagra. Another place is ankle, knees, elbows, wrists, and fingers. When it comes to rheumatoid arthritis, we have the small joints of the hands, of the wrist, and the feet. And it can also affect the larger joints. So that's number 2. And the third one is talking about the onset of the symptoms. Talking about gout, it's sudden and severe, and often at night. When it comes to rheumatoid arthritis, it is gradual in onset and it comes with chronic progression. The fourth one is talking about the pain characteristics. There is intense pain, often in a single joint when we are talking about gout. And talking about rheumatoid arthritis, it is symmetrical joint pain affecting both sides of the body. So for gout, it's one part of the body. For rheumatoid arthritis, it's usually on both sides of the body. Another one is inflammation. Under gout, there's redness, there's swelling, there's warmth in the affected joints. And under rheumatoid arthritis as well, there's swelling, there's tenderness, and there's warmth in multiple joints. And when we are talking about the duration of the symptoms, under gout, it lasts from days to weeks with period of remission. And under rheumatoid arthritis, there's persistence in the symptoms with period of exacerbation and remission. When it comes to morning stiffness, under gout, there's nothing like morning stiffness, but when it comes to rheumatoid arthritis, the morning stiffness usually lasts not more than 30 minutes in the morning. And when we're talking about the systemic symptoms, that's another point. Under gout, it really causes systemic symptoms. Then in rheumatoid arthritis, there is fatigue, there's fever, there's weight loss. I talked about it last week that there can be eye involvement. So there are a lot of systemic damage when it comes to rheumatoid arthritis. Then the diagnosis of gout. Blood tests just to determine the uric acid level. Joint fluid analysis can also be done. Imaging can be done. Those are what can be done to actually diagnose gout. But for rheumatoid arthritis, there can be blood tests, which usually for CCP. I'm not going to tell you the meaning. I want you to go back to my video on rheumatoid arthritis, then you know the meaning of CCP. And another one is to determine the elevated CRP and ESR. I'm going to give you this. ESR is erythrocyte sedimentation rate. But for the CRP and CCP, I want you to visit my previous video on rheumatoid arthritis. Then imaging can also be done. When it comes to the treatment of gout, NSAIDs can be used, colchicine can be used. That's a major drug for gout. Colchicine can be used, corticosteroids can be prescribed, uric acid lowering medications can also be prescribed for the patient. And when it comes to rheumatoid arthritis, DMARDs can be used. Then NSAIDs can be used. Corticosteroids can also be used, and physical therapy can be used. Another one, when we're talking about lifestyle modification, under gout, dietary changes can be encouraged or advised just to encourage the patient, and you can advise weight loss, reducing alcohol intake also. And under rheumatoid arthritis, regular exercise can be advised, smoking cessation, balanced diet. So you want to encourage the patient to eat healthy. Let's talk about risk factors. Under gout, male gender are always at risk more compared to female gender. Then family history also is part of the risk factor. High purine diets is also part of it. Alcohol, certain conditions. Under rheumatoid arthritis, female gender are usually prone to rheumatoid arthritis compared to the male gender. Family history is also part of it. Smoking is part of it. Environmental factors and obesity. Those are the risk factors for rheumatoid arthritis. Then let's talk about the prevention of rheumatoid arthritis. Okay, let's talk about the prevention. So the prevention of gout is managing uric acid level in the body. This will help in the prevention of gout. And when it comes to rheumatoid arthritis, early diagnosis can help, treatment can help, lifestyle modification can help. Okay, so these are the differences between gout and rheumatoid arthritis. I have been talking about gout and rheumatoid arthritis for the past 2 weeks, and this is where we are going to be drawing the curtain for the two. I hope you have been able to learn one or two things if you are asked gout or rheumatoid arthritis. So until the next time, bye.